In a hospital setting where people and resources are more readily accessible, the real challenge becomes logistics. In other words, the coordination of rescuers and resources when more people are involved. However, your first few steps are the same.
First, assess the scene quickly to make sure it is safe for you and the patient, and try to get a response. Then, simultaneously check for breathing and a pulse. If there is no response, no breathing, and no pulse, activate the emergency response system and make sure an AED is on the way. Then, immediately begin CPR, starting with compressions.
When additional rescuers arrive, they are able to assist in the remaining actions, including beginning ventilation with a bag mask device and setting up the AED. There are additional actions that can be taken to increase effectiveness, such as removing the headboard so that it won't be an obstacle during ventilation, and bringing a step stool for the rescuer performing compressions.
The CPR backboard should be put in place as soon as possible. Position the CPR board under the patient while trying to minimize interruptions in chest compressions. As a note, make sure that you know how the beds in your hospital operate. This knowledge could save valuable seconds.
Attach the pads to the patient while the defibrillator is set on AED mode. It's important to be familiar with your AED or defibrillator and to follow your device's prompts for next steps.
The rescuer operating the defibrillator is responsible for clearing the patient for rhythm analysis and before shock delivery. If a shock is advised, clear everyone from touching the patient and deliver the shock. If time allows, compressors can take advantage of the time when the device is charging to deliver a few more crucial compressions. As soon as the shock is delivered, resume compressions immediately with a feedback device that provides real-time corrective feedback on CPR quality of rate, depth, and chest recoil. After each set of 30 compressions, deliver 2 breaths with the bag mask device, ensuring that the chest rises with each breath. Continue these steps until the code team arrives.
Now let's focus on using an AED. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED. Open the carrying case or the top of the unit and immediately power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's bare chest. Use the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the person's age, use the adult pads. On some AEDs, you may need to plug in the pads if they aren't already connected.
After you open the device and power on the unit, follow the prompts and place the adhesive pads on the person's bare chest per the pictures on the pads. Place one pad to the side of the left nipple and the other on the upper right chest, directly below the collarbone. After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the heart's rhythm, followed by a prompt to clear the victim. Strongly repeat the command to clear, checking visually to be sure that all rescuers and bystanders receive the command and follow it. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. You'll repeat the command to those nearby. Loudly state something like, "Everybody clear," and visually check to make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered.
Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED pads or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the AED's voice prompts. If at any time the AED indicates that no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the person's chest is so hairy that the pads can't adhere to the skin, you may quickly shave the area if a razor is provided. If no razor is provided and you have 2 sets of pads, apply 1 set to the hairy chest. If the chest hair prevents the pads from contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then apply a new set of pads to the bare skin.
Excessive water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If a victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.